So I've been working in suicide prevention and helping people with thoughts of suicide and helping survivors of suicide for about the last 12 years. I'm a retired physician. And I also teach mindful self-compassion. So those are kind of the things that I do at this point in life. And whenever I talk about suicide, I'm very aware that many of us have been impacted by suicide in some way in our life, either having suicidal thoughts or behaviors ourselves, or having friends or family who have had to face dealing with suicidal um, thoughts or losses, And so it's really important to take care of yourself while we're learning about suicide, to take a break if you need to, realize that it can bring up difficult feelings and to really give yourself what you need. And especially if you're someone who um, grapples with um, suicidal beliefs and thoughts yourself, or you've lost someone to suicide, to realize that when we're in the midst of these crises, we only know what we know. We can only do what we can do. It's very complicated. It's very complex, and so we really need to be very gentle with ourselves and approach this as best we can without shame, without blame. So this is information that we offer to take with you. Okay. So I often, almost always, start out talking about mental health and suicide and addiction with this slide, because I know how much, just how we talk about how language is so important when we talk about firearms, it's really important when we talk about suicide and mental health as well. And so you'll get this information as a handout sent to you. But just as an example, we hear the words committed suicide very frequently, and even the words completed suicide. And we really prefer to say the person died by suicide, or they took their own life, And so the way I think about it is, if I can substitute, if I can say they died by cancer, and I can put the word cancer in for suicide, then that's a good way to say it, right? Because they didn't commit a crime, they didn't commit a sin, wrongdoing, and they didn't complete something. Completion implies that, oh, it was a good thing. And of course, this is not true for suicide. So these are just a few examples of how language can impact us here. So just a few brief statistics. In 2019, that's the last year we have really complete data for. 2020 is emerging, but we had 47,500, 11 deaths that we know of from suicide in 2019. The numbers do seem to have gone down, not insignificantly, in 2020. So that's of course the year of the pandemic started. And so we're not quite sure where that's going, if that's going to come back up again. There are a lot of very distressed people. You probably know some right now. So we'll see, but that's where we sit. In 2019, the rates of suicide were highest in white middle-aged men. And white males actually, well, in middle-aged men, yes. And then white males account for 69% of suicide deaths in 2019. And this middle age range, this 45 to 54, is a real high-risk time, both for men and women, actually. Firearms in 2019 accounted for over 50% of all suicide deaths in the US. And this is true for Wisconsin too. It's right around 50% of suicides occurred due to a firearm as the means. You may know this or you may not know this, but in Wisconsin, about 70% and more, even some years, of violent firearm deaths are suicide deaths, not homicides. So it's that much more frequent than a homicide. So that's something to really know about. And, you know, there's more and more data coming out. There was a recent study at Stanford that came out in 2020 looking at millions of California residents that persons who own firearms are at much greater risk than persons who do not for dying from suicide. There were much smaller studies in existence before that, but this is the first really big study. And men are at 8 times, have 8 times the risk of using a firearm for suicide as persons who don't own a firearm, and women 35 times as high a risk as women who don't own a firearm. So it's a very significant issue in the realm of suicide. When we talk about suicide, I kind of alluded to this, we're talking about more than suicide deaths. The deaths are kind of the tip of the iceberg. Many, many, many more people attempt suicide and plan suicide and think about suicide. And for every person we lose to suicide, we know that over 100 people are affected in some fairly significant way. You know, we all feel pain when we lose people to suicide. So it's a really huge issue. So when we talk about suicide, we often talk about risk factors and warning signs. Risk factors are things that we have in our history. They're things that are less, some are modifiable, but some less modifiable, like our genetics, our psychological predispositions, where we live, rural versus urban, those types of things. One really huge protective factor, and I'll talk about this a few times, is how connected we are to our life and to other people, to our community, to our family, to our schools, and how much we feel like we belong. This is a big factor for human beings, so it's really important. So then we think about suicide warning signs, and these are things like what situation you're in right now, what behaviors or feelings a person might have, and what person might be saying. And so these, when compounded with some of these background risk factors, add up to increased suicide risk. So situations might be losses of many types, like losing a job, losing a relationship, losing your good health. Behaviors might be things you might see, like a person might be withdrawing. They're not sleeping as well. They're using more drugs and alcohol. They might be saying things like, I feel so hopeless. I feel trapped. I feel like there's no way out of this. What's the purpose of me going on? So when you see some of these warning signs, we take them seriously because they add up to increased risk. So one model for approaching somebody in your life who may be thinking about suicide is this one called Pound Be the One Too. And this comes from the National Suicide Prevention Lifeline and is endorsed by the National Action Alliance for Suicide Prevention, which is really responsible for implementing the National Suicide Prevention Plan. And I like these steps because they're simple and they're accessible, right? I mean, we can kind of put our arms around what they can mean, and they can really come from your heart. And to me, that's really so important when we're trying to connect with somebody. So the steps are, and we'll go through these briefly, one after the other. And this is another page that you'll have as a handout as well. It'll be sent to you. So the steps are, there's 5 steps. Ask, keep them safe, be there, help them connect, and follow up. And so we'll talk about each one of those. So the first step is ask. When you ask a person, are you thinking about suicide? And you say it from a heartful place. You say it in a way that shows you really care. You're not rushing. And you, um, you're really connecting with the person and you're not judging. It really opens the door for that person to speak to you about their distress, or if they're thinking about suicide, either at that point in time or if it came up for them in the future. It shows that you're recognizing how much distress they're in, you recognizing their suffering. And it's really a compassionate thing to ask, because you want to take some action. And so it's really important that when we ask, we also listen. Listening is sort of that flip side of asking. And we want to really hear what they're saying, and we want to let them talk. We want to listen for reasons that they may be experiencing emotional pain, and even more importantly, reasons that they have for living, reasons that they have for staying alive. One question that very rarely gets asked in a clinical situation is, can you share with me how you got to this point of how you're thinking about suicide? It's a very important question, and it's something that we really can listen to very carefully. So, when we're thinking about suicide, they may very well be too. So ask right away. One myth that's out there is that if we ask somebody, are you thinking of suicide? We're going to put the idea in their head. This has been shown through research to absolutely be false. We cannot do that. If you're thinking about it, they've probably thought about it already. And it's a very common thought to have. Some of you may have had that thought yourself, right? So ask, and don't be worried that you're going to make it more likely that they're going to attempt on their life. If anything, it's going to lower their risk. Asking directly and simply, are you thinking about suicide? Are you thinking about killing yourself, without judgment, is really important. Asking privately, with taking your time, giving space. And I think this last part is probably the most important thing on this slide, which is that it doesn't have to be perfect, okay? Just good enough, good enough. And I think the feeling that comes through when you're asking is more important than your words. Our communication is so much more than what our words are. It's so much body language and eyes and all of that. And you know this. So these are some ways you can ask. Even, do you wish you could go to sleep and not wake up? So step 2, be there, be there. Very important that we're present in some way. Now, you may not be able to physically be there, but you can be there via phone, text, Zoom, letters, however you can be there. You do want to, if you are going to say you're going to do something, follow through. If it's something that you just can't commit to, that's okay. Try to get somebody else involved. See if there's somebody else who could be physically present with the person. Who might else be able to support the person? Ask them about it. And we want to inspire hope. Try not to worry alone. This is something that's taken me through my whole clinical career. Don't worry alone. If you're really worrying about somebody, talk to somebody else about it. Get some help. Get a team together to try and help this person. And your presence and support really are an incredibly powerful resource for a person thinking of suicide. Never, never underestimate the power of being present for another person. So suicide is really not the problem. It's the person's solution to their pain. And remembering that when a person is thinking about suicide, they're in incredible psychological pain, incredible pain. They're feeling incredibly hopeless. So asking, these are some examples of questions you can ask, what keeps you going every day? What has stopped you from killing yourself to this point? And again, asking about reasons for wanting to stay alive, looking forward, things you're looking forward to in life. And if they say nothing, well, okay, what made life worth living before you felt so bad. And so you can get at some of this future thinking, reasons for living, really, really helpful. And the kind of the thing that you want to get to is you're not taking suicide away from them as an option, but you're putting so many other alternatives in front of suicide that it becomes much, much more in the background, in the distance. And then you can get some help. So who's important to you? Who can help us? And then we can get that help. Even getting some delay, would you be willing to hold off until we can try some of these alternatives? Okay, then we want to keep them safe. And if we don't know this yet, we want to find out. Does the person have access to lethal means like a firearm? Do they intend to act on a plan that they have? Have they made past attempts? And means really matter. We want to put time and distance in between the person and the means. So, if you've never seen a gun lock, there's a picture on the slide of a firearm with a gun lock in place. We want to lock up guns if they are in the home, secure them, put them in a safe. Better yet, when somebody is suicidal and there's a gun in the home, we want to try to get that firearm out of their home, so that it's safely stored somewhere else. Medications, we want to get meds out of the house so that somebody can't use them to overdose. 90% of people who survive a suicide attempt don't go on later to die by suicide. So if we can get somebody through a suicide crisis, which are usually very brief in that just intensity time where somebody's really intent on taking their life, we can really, really make a difference. Also, safety plans are very helpful. And this is an example of one. I have another page with another example. So figuring out what are the steps somebody can take when they are really feeling suicidal. And one of them is making their environment safe. Again, removing guns, getting meds out of the house. I'm going to skip these slides in the interest of time because we're really running a little longer than I intended. So then we want to help people connect, okay? And so if we can kind of form a safety net around a person with personal and professional supports, putting those in a safety plan, actually listing the people you're going to call if you're in a suicide crisis, listing the professionals we can call, this is really helpful. And then really asking the person, well, who do you have in your life? Who could help us? Do you have a mental health provider? Do you have a medical provider, a nurse practitioner, a physician, somebody that we can go to for some help for you? Clergy, family, friends, teachers, all of these folks can help form this safety net. And you can be part of that safety net too. So that is really what works the best. And then there are resources we can call. These are two examples of around-the-clock resources, the National Suicide Prevention Lifeline number. And coming soon, you may have heard of the legislation for the 3-digit number 988. In Wisconsin, this is due to come in about a year. The Hope line is the crisis text line in Wisconsin, and you can actually text Hope line to 741-741 and get a response. And you as the helper can also make calls to these lines if the person is reluctant to get some advice. Please know that we all have different social situations, and particularly for persons in marginalized communities, persons of color, persons who identify as LGBTQ+, calling 911, calling the police. The National Suicide Prevention Lifeline may call 911 to check on somebody. We need to know these things because it's very different to call 911 as a white lady like I am than it is as a person of color. And there are additional risks there, and we need to be very cognizant of those. Okay, and then finally, we want to follow up. So this gives us an opportunity to check back in, ask, how are you doing? Did you keep your appointment? How can I support you today? This helps the person feel connected, feel like they belong. You care about them. You matter to me. These are such important messages. And this has been actually studied that it really makes a difference in impacting suicide. And especially when somebody's been to the emergency room or they've been hospitalized, risks go up after hospitalization of suicide. Suicide risk is actually higher after discharge from a psychiatric hospitalization for a suicide attempt. So follow up. And so these non-demanding caring contacts, that means we're just saying, how are you doing? I'm not asking you to do anything, but I just care about you. This decreases suicide risk. So these are our steps. Ask, keep them safe, be there, help them connect, and follow up. And so I hope that this is helpful to you in working with folks in your life who may be suicidal and knowing a little bit about what to do. So thanks for being here today.